Hi, I'm Dr. Athena Paradise, and welcome to Talk with the Doc. I'm here to talk to you today about chiropractic care and all the ways that it can benefit you. This is Liz Long. Liz is my chiropractic assistant, and she's here to do some interview with me to help get you the information.
So Dr. Paradise, can you tell me and the audience just a little bit about chiropractic care and why it's beneficial?
Sure. Chiropractic care is unique in the medical field because it interacts directly with the central nervous system and the peripheral nervous system. What that means is your brain and your spinal cord, that's your central nervous system, peripheral nervous system, all the nerves that come out of that and supply your body. You can see here on this spine how the spinal cord comes down and exits in between each vertebra as these spinal nerves. And these spinal nerves actually, in your body, they're not cut off like this. On your body, they look like this. They continue around and reach to every part of your body. So if you're, looking, they move all through the body. And they don't just supply your bones and muscles and joints, they also supply all of your organs, all of your blood vessels, every piece of connective tissue, everything in the body, those nerves wrap around and innervate all of that. So no matter what's going on in your body, if you've got eye problems, if you've got heartburn, if you've got lung issues, guess what? There's nerves that affect all of those areas and therefore can be affected by chiropractic care, whose goal is to align the bony structure of the body so that the nerve flow is unimpeded. If this vertebra is rotated and it's pinching on this nerve or this blood vessel, you get congestion here, you get irritation, you get a buildup of cellular wastes and toxins. They can't be excreted and moved away, and so they sit there and aggravate the area and cause swelling, congestion, pain, spasm. And so when you can free up the flow of that whole nervous system, you get healthy. Healthy nerves, healthy organs, healthy muscles, healthy sensation. You stop having paresthesias where you have numbness, tingling, things like that.
Wow. So I've noticed that we have some patients that have wrist pain, for example, and I've seen you adjust their necks for that. Can you tell us a little bit more about how those things are connected?
Right. I know it can be confusing when you come in with pain down here and I examine this area and decide something's going on here. When you look at wrist pain, it could be coming from the neck because the brachial plexus, this big bundle of nerves, comes right down from the neck and travels down your arm. It could be coming from the shoulder joint not being lined up right. It could be coming from the elbow joint pressing on the nerve or something actually in the wrist. And so you can't just look at the wrist and say, oh, it's just here. You've got to examine all the way down and make sure that the nerve flow is unimpeded that whole way. And sometimes it's bony. Sometimes it's a nerve irritation. If someone's had a bad sprain or strain, they may have pulled on the nerve and irritated the sheath. Sometimes it's muscular. If you've got like a tennis elbow or something, you may have overworked one of the muscles and it's so swollen and spasmed, it's putting pressure on the nerve, which is causing pain and numbness in the hand. Sometimes it's the actual wrist. People, did something or leaned on it the wrong way or hit it, and they've actually knocked a little wrist bone. There's 8 little bones in your wrist, so sometimes it's coming from that. Right. So it's kind of fun. I love my work because of that, because I always feel like a detective. Someone comes in, I'm like, okay, what are we going to discover? It's always exciting.
Awesome.
And it's so fun when you start out, it's not fun when someone's in a lot of pain, but you start out with someone who comes in there in a lot of pain and distress, and then you get to help them come back to being more and more aligned and getting their lives in balance, and then they feel great. It's
Awesome. It's fun to see. So earlier you mentioned like something about heartburn. So if a patient came in with a stomach ache or they were having some digestive problems, would an adjustment help them, or how could chiropractic care help a patient like that?
Right, so the nerves from the middle of the back here come around and supply your digestive organs, your pancreas, your stomach. So many times you can have problems with the vertebra back there, and it affects those nerves, and then you get either not enough stomach acid produced or too much. So either way, you can affect it. You know, my dad was a chiropractor. And so,
I didn't know that.
Yep, and his best friend was an MD. And so when we were kids, if we got sick, we always got adjusted first. If we had a fever, if we were throwing up, if we had a sore throat, we always got adjusted first. I would say 90% of the time, that resolved it.
Wow.
And then the rest of the time, if it didn't resolve, we would go see Dr. Duff, and you know, he would take care of us. I have kids who come on their way to the emergency room with, you know, screaming, crying, swollen red eardrums. Give them a gentle upper neck adjustment, and within 10 minutes, it's all calmed down and totally fine.
Wow.
Now, sometimes it's from an infection.
Right.
Chiropractics, you know, can support that, but it's not going to change it like that. But if what's happening is because of a misalignment of the vertebra, and therefore the pressure on the nerves and things not running right, chiropractic can be miraculous.
Yeah. Wow. Great. Well, thanks for answering those questions and telling me and our friends more.
The other part that goes hand in hand for me with the chiropractic adjusting, being a yoga teacher, having a passion for nutrition, is not just adjusting the spine, but also incorporating what can we do dietarily to bring our bodies into balance. What can we eliminate that we're eating that's causing inflammation, causing fire in our body? Get rid of that so we're not in so much pain. And how can we strengthen and balance the tissues? You know, so many times I can adjust someone and get them out of pain, but if they're not going to do exercises and bring their body back into balance, what's the point? You know, they're just going to have to come back in. And so for me, it's a very clear focus on the part that I do, and then the parts that the patient does, to maintain their own health. And when those three pieces happen, that's when the real magic happens.
Great.
Yeah.
What do you mean by inflammation?
Inflammation is the basis of every disease process. So whether we're talking about heart disease, diabetes, any cancer, it all starts with inflammation, which is kind of like fire in the cells. If you think about your body like a house, inflammation would be like having a fire somewhere, burning away your tissues.
This doesn't sound very good.
That's not good. And you always want to get inflammation down. There's a lot of lab markers that tell us how much inflammation is happening in the body. But every single disease process starts with inflammation.
Wow. And
so the more we can calm down inflammation, and there are some things that just are well known to spike inflammation. Gluten is one. So wheat, barley, rye. Taking that out of your food plan is huge. And if anyone wants more information about that, there's a great book called Grain Brain by Dr. Perlmutter, who's a neurologist who's done a ton of research around that. Gives you very, very clear information about how gluten causes inflammation and what the benefits would be about eliminating that.
Wow. So Dr. Paradise, how many times should someone come a week if they're in pain to get adjusted from you?
Oh, that's a good question. You know, until I do an intake and a full exam on someone, I don't really know.
Right.
For my practice, it's very unusual for me to see someone more than twice a week in the beginning. If they're really in pain and just need a lot of tending, I may see them 2 or 3 times in a week. But as quick as I can, I'm getting them down to once a week. And you know, so that's for an acute injury where something's happened, where they're just needing support. But in general, if people can come in every 6 weeks, a lot of research has shown that that prevents degenerative joint disease, ankylosing spondylitis. It can slow down a lot of the negative processes that happen in the body. So every 6 weeks, I say that's a great time to get in.
If someone's coming to see you just every 6 weeks, what can they do in those 6 weeks if they're not seeing you to make sure their body stays healthy and strong, that their spine doesn't get out of alignment again?
One of the most important factors there is, of course, self-care.
Mm-hmm.
And that would include things like paying attention to your nutrition, paying attention to stretching and exercising so that you keep your body in balance. We do a lot of work with patients, teaching them stretches and exercises to balance and strengthen. And we work with people a lot for nutrition. You know, some people just don't know how to eat. I mean, I grew up not really having a healthy diet. It took me work to learn how to eat things that would nourish my body and not cause inflammation and deplete me. So we do a lot of education around that. One of the great things about working here at Portland Natural Health is that we have a nutritionist on staff. We have acupuncture, massage, we have a neurologist, we have physical therapy, you know, everything, naturopathy is right here. So if a patient needs some support in between, they can just go down the hall and see another wonderful practitioner.
Great.
Any other questions?
I think that's all for right now. Thank you so much.
You're welcome. I also wanted to say there are many ways to adjust the spine. Some of them are more dramatic than others. And one of the things that I'm known for is very gentle, careful adjusting.
Right.
Yeah.
So, yeah. No, we definitely see patients who are nervous about having their neck adjusted, and they always are happy to have your gentle care when they're doing that. And you know, I've seen a lot of folks come in and be nervous and then feel